the gateway to the West, Cardinal Nation. St. Louis, Missouri is home to some of the most brilliant doctors in the world. These doctors are pushing science to its limits, healing patients in new, innovative ways, and doing it at the same time they're teaching the next generation of doctors how to save lives. Meet SLUCare physician Dr. Adrian DiBascelli, a renowned hepatologist who led the team that developed the first treatments for hepatitis C, Dr. Bruce Bacon, whose research helped find a cure for Hep C, and Dr. Brent Tetry, one of the world's most leading experts in fatty liver disease. This is the science of healing.
Hepatitis C is a blood-borne pathogen. It's a virus that is transmitted from person to person by way of blood.
You can't really know unless you go through it. There's so many tragedies in life where people say they understand. They can't possibly know. And everybody in my family thought I wasn't going to make it. My husband, Winona, Ashley, my best friends, my pastor.
The reason hepatitis C is a problem is because it can cause inflammation and scarring and lead to the development of cirrhosis and liver cancer and liver failure.
I looked at a slide of my liver biopsy under the electron microscope, and it actually looked to me like, with my informed eyes, that I was going to die.
Patients with hepatitis C very often just feel bad. They didn't feel right. Many of them complained of not being able to concentrate or being fatigued.
But my guess in my case was that I was working at a hospital in ICU, so I probably got a needle stick. Then we get signed to RCA Records. We had this amazing music career for 8 years, and I started feeling crummy. I felt malaise, I felt like a low-grade temperature, a little bit of a headache. I knew something was really wrong.
So I've had the benefit during my career to watch the evolution of hepatitis C through its whole life cycle.
In the early years, a lot of the research was about trying to understand the disease. A diagnostic test had to be developed so you knew who had hepatitis C and who didn't, what kind of diseases was it associated with. It causes liver disease, but it also causes some other problems. So that was part of the research that was going on. We have a network of liver researchers here at St. Louis University from several departments that have worked on hepatitis C for the last 20 plus years.
In 1989, hepatitis C was discovered and it was named hepatitis C. It was identified as a distinct virus. The first treatments that were used in the early 90s were use of an injectable medicine called interferon, and patients would take injections 3 times a week for 6 months, and maybe 2% of them or 10% of them would have a favorable response and get rid of the virus. A very small percentage of patients would benefit by that, and there were a lot of side effects from the interferon.
I'm a registered nurse. In fact, I was going to become an MD from Winona, wanted to move to Nashville to sing. So I already knew a little bit about hepatic viruses. Obviously, HEPA is the word for liver. Then itis on the end of a word just means inflammation of, infection of. So appendicitis, bronchitis. Hepatic refers to a big inflammation in the liver, hepatitis. I felt terrible, and once I was actually diagnosed with it and told I had 3 years to live, I was furious. But I was going to fight. I had to retire, which absolutely broke my heart and changed my life forever. I became very depressed, started having anxiety disorder. But I was here at the farm, and I fought. I met with experts, studied all of their placebo-based double-blind clinical trials, and eventually I met Dr. Bruce Bacon.
I've been blessed to have a lot of really wonderful patients to take care of over the years, and one that really stands out was Naomi Judd.
He was fabulous, and I knew it the minute I met him. We were doing PSAs, public service announcements together, and I went, wow, I just asked you a question, you said you don't know the answer, but you'll find out. I've never heard a doctor say they didn't know. I just fell for him. He was Dr. Right.
I'll never forget, on a Friday afternoon, we'd had conference at noontime, and I got a page, and my secretary, he said, we got a call from Naomi Judd.
We were put together. We had never met each other, heard about each other. He had no idea who I was, which was fun, because he saw me as a person.
And she kind of told her story. She had hepatitis C. She had been a nurse before she was a singer. She'd gotten needle sticks, and she felt bad from the hepatitis C. She was very fatigued, and there was a lot in the media at that time that she and Winona had stopped their tour at the time. And
Dr. Bruce he laughed. He had this little boy grin. He laughed at my corny jokes. We just felt like we'd known each other for a long time. He has that way about him, and that's what you want in a doctor. You want somebody that gets it.
And she was cured. So that happened in a small percentage of people back then. This was in the mid-90s, and she was one of those people.
It was better than winning 6 Grammys. It meant my life. I was in the Michelangelo Hotel, room 307 in New York City in 1985. It was winter. Ashley was with me. Dr. Bacon called, and I held the phone out like this because he was getting ready. He said, I've got some very special, important news to tell you. And I was waiting for my count. I held it like this so Ashley could hear. And then when he said, you're cured, I remember hearing Ashley gasp. Then I started. He had to repeat it several times. And I just began sobbing, and we talked for a few more minutes about how it all came to be and what he thought my prognosis was. Then Ashley and I walked down to a cathedral and got down on our knees on the cold marble floor and just thanked God for saving me. And she was crying, I was crying. We hadn't brought any Kleenex. We were using the hem of our skirts. Funny the things you remember.
I often say to patients, I point out to them how powerful the word cure is. You can say, I'm better, or I'm feeling okay, but cure is really powerful. I mean, it's in our lexicon, in our vocabulary, cure is a really important word, and they get it.
Attribute him with saving my life.
What exploded for us in hepatitis C was not through the first 10 years of the new millennium, but actually in around 2011, 2012 was the introduction of new antiviral agents that didn't require the use of interferon for their effectiveness. Actually, there were 2 of them approved by the Food and Drug Administration in late 2013. And they were approved with interferon and ribavirin. So it was interferon, ribavirin, and samiprovir, interferon and ribavirin, and sivosvir. And a lot of us that had used interferon for decades and seen all the side effects from it said, well, what if we used samiprovir and sivosvir together without the interferon? And a lot of people were talking like this. And that wasn't the approved regimen, but that's what a lot of people did.
I've spent a lot of time actually conducting research, but also consulting for some of the drug companies developing these drugs. And it always seemed promising and exciting, but I actually remember the day in which it became apparent that this would be a real thing. There was a scientific presentation at the Liver Society meeting, which is in November, and a presenter showed data on about a small number of patients, 20 or 30 patients, using interferon-free regimens. And he showed the results, and the cure rate was 10 out of 10 in this group, and 10 out of 10 in this group, and there were gasps, literally. The room was packed, but there were gasps. People were astounded because we'd never believed 100% was possible. And I actually remember sitting in the room that day.
That first year in 2014, I cured about 400 patients with a combination of cimipravir and sibosavir without the interferon. So we were off and running then in the post-interferon days.
We now feel like we can cure almost anybody, almost everybody with hepatitis C, if not the first attempt, perhaps the second or third attempt. Very different than the old days when we were curing 5% of patients, 10% of patients. We crept it up to 50% and now approaching 100%.
So we've come full circle from discovery of the virus in the, what would that have been, the late 1980s, discovery of the virus to now being able to cure just about everybody that has it.
This is actually, I think, one of the, maybe the only chronic disease that we can cure. Usually chronic diseases, ones that go on and persist, we manage them the best that we can. Here we just cure it.
I have been in Paducah most of my life. We're 3 hours away from St. Louis, and I've learned the trip very well in 20 years. I was diagnosed in 1996 with hepatitis during a routine physical. In 2003, Dr. DiBichele was conducting a clinical trial.
Janelle was a participant in a very large national scale clinical trial that was called the HALT-C trial. I was the chair of the steering committee.
With his expertise and intuition, that same year he recommended that I have an MRI because he felt like something wasn't right. And when they did the MRI, they found tumors in my liver.
It was at an early stage, as one might have hoped.
And the only treatment was a transplant. After the transplant, the Hep C came back.
With the new treatments now, it doesn't really matter too much because we can treat them. So we can give them a new liver gets reinfected, and then we treat them with the new medicine to get rid of it. And that's what happened with Janelle. She got hepatitis C in the new liver, but fortunately by then we had newer, better treatments already available that she could take advantage of.
I did that and cleared. To see those words, I think I took a picture of them and sent them everywhere to everybody. So it was great.
And having known Janelle for more than a decade and knowing the struggles she went through with trying multiple treatments, and it was very gratifying to know that finally, after all these years, she was rid of her hepatitis C.
Oh, I owe Dr. DiBichele my life, I mean, literally, and I tell him that, because if he hadn't had me have the MRI and find the tumors, the cancer would have progressed and I wouldn't have been eligible for a transplant.
I believe Janelle told me that her daughter had hepatitis C, and she thought that she was the one who transmitted the hepatitis C to her daughter at birth or shortly after birth.
She has 3 sons, and her middle son has Hep C also. And she also goes to Dr. Bacon and did treatment last year, and she's now cleared of the Hep C. My grandson is 11, and hopefully the end of this year, FDA will have treatment plans available for 12-year-olds. And hopefully he'll be cleared as well. So
this is 3 generations now of this family. You have hepatitis C spread from one to the other, and we have 2 generations now treated. The hepatitis C is eliminated, and when this grandson is treated, that will be the end of this condition in this family. It'll be over. Because hepatitis C doesn't cause any symptoms until it's too late, until it's very advanced, we feel that the best way to know about it is to get a blood test. The CDC recommends testing, one-time testing, for all baby boomers, those born between 1945 and 1965, because in that group is where the largest number of individuals with hepatitis C are. But there's a new epidemic of hepatitis C. This is quite literally an epidemic, and that's among young people who are injecting themselves with heroin and other opiates. So there are these young people that we're now seeing in our office who may be just clean and sober for a couple of months, and in the rehab process it's been found they have hepatitis C.
One of the things that's happening with hepatitis C treatment being as successful as it is, we're seeing the numbers are starting to go down a little bit. We're not having so many people on our doorstep waiting for treatment. But filling those slots right away of patients with fatty liver disease. And there's estimated over 25 million people in the United States who have liver disease due to fat in the liver.
Researchers here at St. Louis University have been involved in fatty liver disease for a very long time. Actually, Dr. Bacon was one of the first to describe the entity. It's also kind of a newly described disease. We didn't appreciate it until perhaps 15 or 20 years ago, and it's increased in frequency.
Fatty liver is where fat builds up in liver cells spread out throughout the whole liver. It's not just an isolated pocket of fat. Sometimes I get asked that if the surgeons can go in and just remove that fat. Well, it's not. It's just spread throughout the entire liver. And the fat accumulates in the liver for a number of reasons. A lot of them have to do with what we eat. A lot of it's genetic, unfortunately.
The number of patients that we're seeing is just growing. As I am in my clinic seeing patients every week, the proportion that show up with raised liver enzyme counts of unknown reason or known to have fatty liver disease is just going up and up and up.
Dr. Tetri is actually one of the world's experts in fatty liver disease. And he's involved in lots of trials developing new medications for treatment of fatty liver disease. We see lots of it.
There are really no symptoms associated with fatty liver disease that are specific. Many of the patients that we see are found incidentally through blood tests. They have so-called raised liver enzyme counts. Their doctor might be ordering a blood test for some other reason, often to measure the effect of some of the medicines they're taking, and it's noted that they have raised liver enzyme counts. So they are then sent to us to try to figure out why, and we typically will do a series of tests to look for things like hepatitis B and hepatitis C and ask them about their alcohol consumption. But then when all of that has been excluded, what we're left with is probably fatty liver disease.
Well, about 5 years ago, I was diagnosed with just elevated liver enzymes. So my doctor ran the typical test that they do first, which is like the hepatitis panel, to see if that's the reason why my liver enzymes were elevated. And that was my primary care doctor. He just ran the hepatitis panel and it came back clean, and then we just kind of left it there. We didn't do anything else about it for like 5 years. And then I started working at St. Louis University.
Charlie came to us looking for a job as a research nurse. He was a very busy emergency room nurse, and he wanted to get into research and saw this as a great opportunity, and we thought he would be fantastic for this.
I thought, well, maybe I should look into this further myself. So I talked to Dr. Tetri.
It had me worried because I see this very commonly, and Charlie's overweight, and that's a risk factor for having fatty liver disease, or Nash, as we call it, when the fat is doing a lot of damage. So I talked to Charlie about that, and I said, you know, you could have Nash, and you could have a fair amount of damage going on in your liver.
So we scheduled a liver biopsy, and I was diagnosed with fatty liver.
Being a nurse, he sees people in healthcare, and he knows that you have to be on top of these things to figure stuff out early rather than let it go and run into a lot of complications later.
I do feel very lucky. Like I said, if I hadn't started working with the doctors at SLUCare, I wouldn't have probably ever done anything about it until it was too late. And I came from working in the emergency department, and I've seen patients at the end of their life that started with fatty liver. It's a very sad thing to watch. They have a swollen abdomen. Their eyes and their skin is yellow and itchy. The blood pressure is bad. The kidneys start to fail because there's a connection between the kidneys and the liver. There's a point to where you just know there's nothing more you can do for them except make them comfortable as possible. And being in the emergency room, I usually saw people at the end of that process. Because in the middle of having Nash or in earlier stages, you can function pretty much like everyone else. Towards the end, it's a very sad thing to see. And I don't want to have that happen to me.
We know from a number of studies that have been done, it really makes a difference for the liver. Being regularly active, exercise, and eating healthy, it pulls the fat out of the liver and starts to cut down on the damage in the liver. One of the things we see with any form of liver disease is the buildup of scar tissue in the liver. That can build all the way up to the point of cirrhosis. Now, we used to think that scar tissue, once it was there to stay. It was irreversible. But we've realized with a lot of treatments now that we can get that scar tissue to actually improve too. So that's what we hope to see with Charlie.
It's a bit of a wake-up call, knowing I was heading down that path, that I could have been one of those patients in the emergency room with hours left. And I want to be there for my kids, I want to be there for my grandkids.
Charlie is very attentive to his health care, and I think that he'll be on the right track.
As a doctor, he's great. I think Dr. Tetri is a great doctor, and I know just that he's one of the top hepatologists in the country, if not the world, and I'm extremely fortunate to have him as my hepatologist. Having him as a doctor, he's got a great sense of humor, and he's very personable, and I enjoy my visits with him because I know that I'll get the best possible care with Dr. Tetri.
I first started not feeling well in 2013, shortly after my daughter was born. And I knew it was a little bit more than just being tired from having a newborn. So I went to my general practitioner. He put me in contact with Dr. Tetri.
Jennifer had a history of elevated liver enzymes too, and she'd had a biopsy even before I met her that showed fatty liver. It showed Nash, which is a type of fatty liver with a lot of damage in the liver, and she had a fair amount of scar tissue in her liver at that time too, and that dates back maybe 5 years ago. So that was a worry.
I knew I wasn't healthy. I knew that I was overweight. My husband and I struggled with fertility for several years, and it was very emotionally and physically exhausting, and I ballooned up then. So I knew I wasn't healthy, but I had no idea what was going on inside and all the damage that I was causing to my organs inside.
It can be serious, and this is one of the frustrations of working in the field. I hear the common phrase of, "It's just fatty liver." And you know, this is a real problem because then you can say, well, it just develops into cirrhosis and then you just die. So how often does that happen? Am I raising unnecessary alarms? I don't think so, because right now we think about 1/3 to half of all adults have too much fat in their liver. Probably in the range, of 5 to 10% of people have a lot of damage going on in the liver, and some of those will go on to cirrhosis of the liver. We often think of cirrhosis being related to alcohol. There's a lot of causes of cirrhosis. Hepatitis C, which we talked about, is one of them. Fatty liver is a cause of cirrhosis. So right now the numbers we're looking at estimate that we're dealing with maybe 1 to 2% of all adults are at risk for going on to cirrhosis from Nash.
I was scared, and it was a huge wake-up call for me because I worked so hard to get these kids, and the thought of not being here with them was very upsetting, and that's when I decided I need to make a change.
So when she met with me originally, we really developed a plan for her to find ways to be more active. And now she's a runner, and she lost some weight, and she's very active on a regular basis, and her liver has gotten a whole lot better.
I've lost about 60 pounds.
Nash is reversible for many people that are able to actively engage in what we call lifestyle modification, which means getting rid of all the extra sugar like soft drinks and things like that.
I was shocked when I had lost the weight and went back, and he said that I had basically reversed the disease, that the fat was all out of my liver and all my enzymes were great, and he said that is fantastic, and it's rare.
I think it looks very bright. I think as long as she's able to continue doing what she's doing, is staying active, eating healthy, that her liver will do quite well.
I think what's saved my life is going to the doctor, really learning what was going on, taking their advice, and taking my time and knowing everyone's journey is different. And I just did a little bit each day, and just trying to get to be the best me that I could be for my family.
We are on the forefront right now, and it's largely due to the clinical trials unit in liver disease that Dr. DiBicelli and Dr. Bacon set up here a number of years ago, really to initiate the viral hepatitis studies. So we had an existing infrastructure, and now that we're doing a lot fewer hepatitis studies for viral hepatitis, we're doing more of the Nash studies, the fatty liver disease studies with new medications.
I think one of the most gratifying things for me when I'm asked as well is the colleagues that I work with, the team that we've developed to focus on liver disease. We work in the laboratory, we work to take care of patients, we work with liver transplantation, we do clinical trials, and that's helped us build a national reputation. It's boosted the careers of all of us, but at the end of the day, we're really pleased to be able to help patients.
Very proud of it. It's a wonderful thing to be part of, to see the advances.
One of the things I've always felt about SLUCare and SLUCare physicians is that because we are a somewhat smaller institutional, the care that patients get, the attention that they get is more personal. You feel like you're actually talking with patients and communicating with them, but obviously we're world experts, we know what we're doing, but it's in a more personal way.
We have really the full spectrum of liver-related care that you could possibly need. And hopefully you never need any of it, but if you do, it's all pretty much here.
We've really achieved international recognition. All three of us are regularly invited around the world to lecture on the topic and be involved in all aspects of liver disease.
Easy to forget the amazing things that they've done for people. I mean, the number of people that these doctors have helped I just can't even imagine.
I am so blessed to have found Dr. Bacon and Dr. DiBicelli.
The SLU's a trusted facility, and I just felt like I was in very good hands.
So the fact that I'm now this medically documented miracle is just, it's a miracle.